COVID-19 lockdowns had major short-term effects on air pollution around the world. Scientists have utilized this time to examine how changes in human behavior can improve air pollution. This presentation will cover the problems air pollution causes, sources of pollution, and summarizes the results of several studies from across the globe that compared air pollution levels during lockdown to the levels in the previous years for the same months. Air pollution is estimated to cause between 5.5 and 7 million premature deaths every year by contributing to diseases such as heart disease, stroke, chronic obstructive pulmonary disease, lung cancer, and pneumonia. Air pollution also damages our environment and contributes to global warming. The World Health Organization is an excellent resource for more information on air pollution. Globally, air pollution ranks fourth in the risk factors for death. Air quality varies by country. China and India have some of the worst air quality in the world, and thus have the most to gain from improvements in air quality. Sources of pollution include heating of homes, open burning, cooking, agriculture, transportation, and energy generation. Lockdowns primarily reduce pollution by limiting the use of transportation. Today we will be looking at the changes in levels of 3 pollutants in China, India, and the United States during lockdowns. The three air pollutants we will examine today are particulate matter 2.5, nitrogen dioxide, and ozone. Particulate matter 2.5 is tiny particulate matter that can lodge in the lungs and cause health problems. Nitrogen dioxide is a gas that is produced when burning fuel. Nitrogen dioxide can cause irritation of the lungs and worsen respiratory diseases like asthma. Ozone is 3 atoms of oxygen. It protects our environment when it is in the upper atmosphere, but when it is at ground level causes a variety of health problems and is the primary ingredient in smog. Vehicle emissions is the primary source of particulate matter 2.5 and nitrogen dioxide in most countries. Ozone is created by chemical reactions from other pollutants, including nitrogen dioxide. During lockdown, more people were staying at home and using vehicles less. We will start by looking at the impact of changes in human behavior on these pollutants in Wuhan, China. The COVID-19 outbreak started in Wuhan, China, which is the 9th largest city in China. A study by Sicard et al. Found that nitrogen dioxide levels in Wuhan were 56.8% lower during lockdown than in the same time during the previous 3 years. Particulate matter 2.5 reduction was 36% greater in Wuhan than southern European cities in the study. While many countries' primary source of particulate matter 2.5 pollution is transportation, in China, a large portion comes from the coal use, which was reduced during the lockdown. The cessation of smelting industries activity during lockdown contributed to this extra reduction. Ozone levels, however, were 35.1% higher during lockdown than during the previous 3 years. Scientists attribute this increase to how ozone formation is affected by the changes in levels of the primary pollutants. Ozone levels also increased in the southern European cities and in some regions of India. In India, particulate matter is the primary pollutant and was estimated to contribute to the premature death of about 1 million people in India in 2015. India launched a plan in 2019 to reduce particulate matter by 30% by 2024, so a portion of the results in India may be attributable to this plan. Particulate matter was reduced during lockdown by 43%. Overall, India saw a 30% improvement in air quality index during lockdown, with improvements varying by region from 15% to 44%. While India and China had strict lockdowns, the United States did not, which makes for an interesting comparison. Lockdown measures in the United States varied from state to state. One study found that states that required early closures of non-essential businesses had an average reduction in particulate matter 2.5 of 11.3%, while counties that did not require early business closures did not have a significant reduction. Nitrogen dioxide reduction was also greater in states that required early business closures. Urban counties showed greater reductions in nitrogen dioxide and particulate matter, 2.5, than rural counties. Urban areas had worse air pollution before the pandemic and thus had more potential for a reduction. Here are the references for the studies I referred to in this presentation.